Welcome to another broadcast from mindyourhealthcast.com, bringing you interesting and provocative and probably sometimes things you would say that sounds like a lot of hogwash related to the health field. I have my rose-colored glasses on because basically that still seems to be the issue in our world and in particular this country, that when we talk to the medical profession, everybody has a big smile and thinks of science, latest technology, concern for patient welfare, interested in making people well. That's what we think. But when you take off the glasses and start looking, you find that that's not really the case. We have a medical industry that has grown in power over the years to the point that they have pretty much made people go to their therapies and suppressed and repressed others. Now, of course, as you know, this is the third broadcast of three related to suppressed and forbidden therapies of all sorts. And there's really not enough time to get into all of them. We're going to kind of recap in different categories some of the key ones that have been the target because they were so successful. Now, I mentioned earlier in the broadcast that the book Politics in Healing is an important one to read by someone by the name of Daniel Haley, and it's about the suppression and manipulation of American medicine. Now, I know that no one wants to believe that anyone would be in the health field and be responsible for the profession of medicine that wasn't interested in the welfare of the public and producing and making available the latest and best things that are going to get people well. However, as you look back at the history, and as I've mentioned before, I've spent a lot of time over the last year or maybe into the second year of researching the history of medicine and the history of health, and in particular in this country. But since we've moved into a world society, pretty much it's applying around the world. We're going to talk a little bit more about what you need to do for yourself as a consumer, and that's what this is all about. Remember, you're the one that has the problem. It's your body, your health, and your life at stake. And so as a consumer of products and services related to that, it's up to you to educate yourself and to find out what's going on and find out if you're getting, number one, the best thing for your dollar, and number two, is it going to deliver results, and number three, is it dangerous? And you are led to believe by the medical establishment that that's what you're getting, and you're paying a high price for it. I mentioned before, $2.7 trillion in a year for so-called health care, which is really sick care, and it's important that you get that in your mind, that it's sick care. And why is it sick care? Because if you are utilizing drugs that are not created to cure anything but to make you feel better, then you're always going to be sick, and you'll always be back for more. Now, when we're talking business, that's great. We're actually talking healthcare, and again, there's nothing wrong with making money if you provide what it is that you're paying for or getting paid for. In other words, if you're going to offer a service or I don't care what it is, a medicine, an herb, a homeopathic, a treatment, acupuncture, whatever, then it really needs to have the effects that it's supposed to, at least in most people. Now, there's going to be a few people, because of strange circumstances or unusual conditions of their body, that it may not work for them, but they may have to shop for something else. But the answers are out there. The problem is that they're being kept from you, at least the ones that are inexpensive and effective. Now, we're going to talk a little bit more. I mentioned last time there were 4 categories which that we were talking about. First of all, that the whole thing has happened. Number two, that we were talking about nutritional. And of course, I want to remind you that the medical establishment, especially the pharmaceuticals, for years and years, poo-pooed taking supplements. They said it was a waste of your money, you were generating expensive urine, and it was of no benefit. But isn't it interesting how suddenly, when they became aware that people were buying them anyhow, and when the bill got up pretty high, that people were spending for it, the medical industry knew that it was coming out of their pocket. In other words, if you take a multivitamin, and you don't get sick, or you get sick less frequently, then that money that was spent on that, number one, came out of their pocket, and number two, you are sabotaging future business. And so they argued this for years. I remember, I've been around long enough that I've seen all of these things happen that I'm talking about. So consequently, when it became evident that money was being spent on supplements regardless of the bad publicity, guess what? All of a sudden, out of the blue, the pharmaceuticals came out with their cheap synthetic substitute for good vitamins and started selling them as though, well, of course, everyone knows that you need to take vitamins. And it went so far that they put out a PDR on nutritional supplements because, after all, everyone knows you need vitamin C, even though Linus Pauling, who was awarded the Nobel Prize twice, who was the world's expert on research and knowledge in vitamin C, was poo-pooed. He was called crazy, dumb, feeble, and the funny thing about it is he lived to 93 years of age and worked right up until he died, and all of the original people who poo-pooed him and who were much younger than him were all dead by the time he died, and yet they argued to the end that vitamin C was a waste of money, that it was ridiculous, that you shouldn't spend your money on it, and went on and on and on and on. And I remember all those arguments, and I remember the attempt to try to make him appear to be something less than what he was. But guess what? He survived all of that and proved to be true. So it's interesting how an industry, and I say an industry, there is a difference between medicine as a healing art and medicine as an industry. And the power structure up on the top end, as well as the pharmaceuticals, stand to gain when people believe that only real drugs are what they need. And so they poo-pooed themselves, but of course they never admitted it, that, well, those vitamins are a waste of money. Now, yeah, buy our vitamins. And so they spend national ads at millions of dollars and sell a lot of, in my mind, pretty worthless vitamins. That's my opinion. If they're made from synthetic sources, then I have great question as to their value. On the other hand, Dr. Royal Lee, way back in the 30s, when he realized that the soil was depleted, the food was depleted, and therefore people were getting sick, he developed a natural vitamin made from plants and soil, good soil, that they were growing in, and those supplements worked extremely well. So much so that right away an attack was started against Dr. Fuller Royal, or Dr. Royal Lee, I'm sorry. There's another doctor by the name Dr. Fuller Royal. Dr. Royal Lee, they started a campaign, and they got the FDA involved, and they tried to shut him down, and he spent years and a fortune defending the ability to make supplements available. And so now what happens? Out of the blue, they want you to forget what all those things were they said now and come and buy their vitamins. And they put some pretty big, expensive ads out peddling those supplements that they're producing in their labs. So this goes on, and I don't think the average person is really aware of how bad the problem is. Now, we've mentioned a few people. I mentioned Dr. Royal Lee and how much he was harassed, went to court. Fortunately, he ultimately prevailed, but nonetheless, they pretty much broke him along the way of making those available. Now, was he doing it because he was going to make a pile of money Evidently not, because he didn't. He probably spent as much, if not more. He was a dentist originally, but he was an inventor. And I think had he not have been able to make money from some of the inventions that he came up with that improved the dental profession, he probably would not have been able to afford to keep going, and they hope to break him, because that's one of the methods that are used to keep products from getting out is you harass and keep the person in court, and you break them financially, and or you ruin their reputation, and almost always it's both. This person has to be a quack, or yeah, they're just trying to take your money. They're selling you something for $10 and we're selling you a drug for $20 a pill, but they're just trying to break you. And of course the $20 a pill is only going to make you feel a little better, but is not solving any health problem, nor was it designed to. And they are good at it. They hire the best advertising agencies. They have the money to carry on all kinds of campaigns. And they have the power because they donate tremendous amounts of money to the legislatures for their PAC funds so they can get reelected. So you can bet they're not going to do anything to rock the boat. They'll just do what they want to do. But for the public, I guess it's who cares as long as we can get reelected. So here we have all these things that have come up over the years. And it's not new. It goes way back. If you start looking back at some statements, and I want to do that on the front end before we get to the end, because then we won't get these in. But there were some comments made. Here's one by a medical doctor by the name of Stanley Wohl, MD, American physician. But he wrote a book called Consumer Advocate because he realized that. And I'm saying this because not all doctors get caught up in this. You know, they go through medical school, and all the time they're going through medical school, they are courted by the drug companies. The first day they walk in, they're handed a packet of goodies, and they're taken out to dinners and lunches, and they're provided all kinds of things to encourage them to prescribe their drugs, and they court them through the whole program. The medical schools are going to propose the same thing because they likewise get big handouts from the pharmaceuticals for the colleges that teach medicine. So at any rate, by the time the doctor gets out, they're told, we are scientific, we are giving you the best there is to treat people with, and they believe that. So they come out ready to start treating people, and then after a while, guess what they find out? The people aren't getting well. They have a problem, they keep coming back, or if the problem gets worse, or new things pop up. And of course, it's very good for practice building, but very bad for people's health. So consequently, it ends up that some doctors wake up pretty fast and say, now wait a minute, people aren't getting well, something is wrong, and they start looking. And when they do, they become very distressed at what they find out. They find out there are things out there that can get people well, but it's not part of their repertoire. The reason being it's been suppressed, or it's been actually forbidden. Now, in other words, I mentioned earlier Dr. Kelly, who was a researcher, developed cancer of the pancreas and almost died. He was eventually decided when he had 1 week left, because that's what the doctors told him, you have 1 week left, he decided to take his health in his own hands. He got well from his pancreatic cancer, and when other people wanted to know what he did, and he told them right away, the authorities jumped on him to shut him up. And when he put out a book about, and as he was encouraged to do, about his experience, the federal government got a court order that he couldn't sell the book because it was misleading. But it wasn't misleading. He did get well. He was living proof of it. And the records were there to document it. And so he had eventually had to leave the country because he could not do anything here. They were on his back constantly. I mentioned Jonathan Wright earlier out in Washington, contemporary doctor who harassed the FDA because they pulled a good supplement off the market for no good reason and refused to put it back on. And guess what? His office was raided by federal marshals and his records taken, his hard drives from his computer, the staff held at gunpoint. That's the type of thing that happens when doctors do decide to actually want to get people well. they are immediately jumped on. They're discredited, they take their license, they break them financially, and they end up unable to work because of it. And I know several personally. It's not a rare thing that it happens. It happens a lot. And so my purpose of this broadcast is to provoke you. Go look for yourself. Don't take my word for it. I mentioned this book, Politics and Healing. I mentioned a website called educateyourself.org. And you can go there, and there's lots of resources to take you to documentation of all the things we're talking about. So I was going to read you these quotes because I thought it was interesting. This Stanley Wall, MD, for the medical profession, this era may well be one of the most shameful and ethically questionable in history. And it's true. It has become a big business, and once it became a big business, they do everything they can to protect it. Another, again, Linus Pauling says, he actually got 2 Nobel Prizes. Now, how many researchers in the world that contribute to the welfare of the world get 2 Nobel Prizes? Well, no, Linus Pauling received 2. And here's what he said. Everyone should know that most cancer research is largely a fraud, and that the major cancer research organizations are derelict in their duties to the people who support them. Now, you're probably thinking, well, now, that couldn't be true. Look what they say when they put out their ads to get you to contribute money. Why, they have promising cures for cancer. Every time that it's time for a campaign to take in money for research. And I'd like to say that a lot of the people in the research field are living a very good life off of money donated to find a cure, when in fact there never can be a cure produced by regular medicine for the public, because it would cut their own throat. It would be like shooting themselves in the foot to come up with a cure when you have a profession or specialty of the profession that concentrates on cancer, and every person who comes to them to be treated, from the time they're diagnosed until the time they are treated to death, they bring in $1 million. And sometimes more, sometimes a little less, but on the average $1 million. You can't afford it. Every one you lose, you see $1 million walk out the door. Now, he was right. The research that they do will never come up with an answer, because it would be to their disadvantage. But they can all make a good living if they keep people coming and keep them promised, oh, we're close, this looks very good, it shows great promise. And I've watched all these different things that showed great promise come and go, but guess what happened? Not one has ever produced, and you still hear all these commercials, you hear all these people interviewed on television, you read all these articles. Well, this looks promising, it looks promising, and for the last, 200 years it's looked promising that something might happen. In the meantime, on the side, people have been going to other types of therapies and have gotten well, but of course you don't ever hear about those, and you're not going to see them interviewed on national TV. Why? Because guess where the major source of income is for advertising to all the major networks? It's not coming from alternative people, because they can't advertise because it's not permitted. But the pharmaceuticals can come on and they can tell anything they want about anything, and it's okay. And because, after all, they're scientific. Now, you might want to do yourself a favor and go out and buy yourself a book on scientific research and look at what constitutes scientific research, and then see what's going on out there and see if it's conforming to science. You know, it's interesting because that term science became such a big term and such a favorable term. You know, in terms we would, definition, we would call it honorific. You know, everybody's for it. And it must be good. So if you say, well, science has proven, well, I know what science proves because I've followed through a lot of the research myself, and you'll be surprised how many research projects come back negative to the product, and for somehow they don't get included in that final research that goes out, or it's just hidden. And a lot of times with court cases, this background material has all come out and showing that they in fact knew what was going to happen. They knew there was a problem, but they wanted to recover their money because they had put a lot of money into researching it, and now they needed to get that money back. Okay, so that's what Pauling says. Then we have Otto Warburg, who also was a two-time Nobel laureate. Unfortunately, he couldn't receive his second one because of being a Jewish background in Nazi Germany. He was kept from getting the second Nobel Prize that he should have gotten. He said, "The American public has no idea how politics secretly control the practice of medicine. If a doctor dares to introduce a natural, less costly method, no matter how safe or effective, organized American medicine can target the doctor for license revocation using fear tactics and legal maneuverings. Why do holistic therapies threaten medicine? Firstly, they involve a major change in scientific thought." Which means, because the science has a position that they believe, then if somebody comes along with something different, it couldn't be good because they didn't come up with it. They imply that current methods are inadequate, and thirdly, they threaten huge profits. So these are some of the things that are being said about all of the things that are going on, and I could read you more, but it all comes out to the same thing. This is a book called The Cancer Blackout, because as I say, cancer is one of the favorites because it's a big moneymaker. This guy's name was Nat Morris, and he said, "It's very difficult to believe that the very centers entrusted with research in cancer at such enormous expenses are inhibiting the application of scientific knowledge in cancer. But it is not so difficult to understand once the economics of cancer is grasped. The treatment of cancer is, after all, a business which is very lucrative and very expensive for the consumer. The goal of most exclusively profit-minded businessmen is to sell their commodity at the highest price possible in a market where they can eliminate all competition and customers have no choice but their commodity. Such entrepreneurs secure a monopoly by convincing their customers that theirs is the only valid product available and that competitors are frauds whose product is worthless. A monopoly of any market is a sure source of profit. A captive clientele has no other choice. The sellers can charge any price the market will bear and can evade any responsibility for bad results because they do not and cannot give any guarantees. They eliminate all critics of their products and challenges to their authority. Their business prospers. Thousands of new customers constantly replace those that disappeared. The original John D. Rockefeller was no mean hand at spotting the commercial possibilities in any expertise. And he did. John D. Rockefeller and his family were all treated with homeopathic medicine, which is a natural source, but he made millions in the pharmaceutical industry. And so he publicly, that's what he advocated, take those drugs. But on the other hand, he and his family had nothing to do with them. Now, that's not probably true today, but it was back then. As his millions came in, he kept reinvesting in the most profitable businesses. One day, when appendectomies were the rage in the medical profession, a surgeon told John D. that everyone should have an appendectomy before the age of 16 as a preventative. The oil wizard saw the point at once. Why? You've got a better thing than Standard Oil, which was, of course, his big baby that brought him a fortune in money. So the fact is, no matter what they say, I know what the motivation is. And as I say, there are a few good doctors who realize all that, but those are the ones that get in trouble. And I've known several who have lost their license because they dared to get people well using natural methods that were much less expensive and certainly much less harmful than the ones that are used today. If they give you a dose of chemotherapy and you drop dead during that dose, everybody accepts that as okay. And it happens over and over in this country, but that's okay because that is the scientific treatment What it means is that's the only treatment they have available that they can market and patent and make a fortune on. They know other things are out there, and some of the people who have developed those, if they refuse to let them have exclusive rights, meaning the medical industry, and charge what they wanted, they then destroyed the person and poo-pooed the product that they had. And that's happened over and over. Hoxsey happens to have been one. Dr. Hoxsey, I mentioned him before. He had to leave the country. They closed down all of his clinics because he had developed, his family had, back along the way, an herbal combination that many people got well with cancer with. And so he was approached by the head of the AMA to let them have the formula. When he said, I have no problem with that, I will let you have it, but you have to sign an agreement that you will not charge outlandish prices for it, number one. And number two, if anybody comes to be treated and they cannot afford it, then you have to treat them free, which is what he did. And they said, of course not. We do what we want once we have it. So he said, then you won't have it. And so immediately his clinics were all closed down within 2 weeks all over the country, and he ended up having to relocate in Mexico, where his clinic is still there, and now he has passed on, but the clinic still operates. So this is the type of thing that happens when someone comes up with something that's beneficial. I've read a case a while back about a salve. Now, we were talking about nutrients and herbs, of course, has been harassed like crazy. This salve is called, well, by different names. This one in particular, the brand, was called Cansema. And what it does is, and I know it does because I've watched it work, you apply it topically over a tumor, and it will draw the tumor out to the surface and kill it, and that's the end of it. I've known women who had breast tumors pulled, that's what they call it, pulling with the salve, because it literally pulls it out. And I've seen them 20 and 30 years later, and they never had a return of the breast cancer because they cleaned up their life, and once it was gone, and that was the end of it. And did they have to pay $1 million to get that done? No. A few hundred, or maybe a couple, 3,000 at the most, if that. And so they were able to successfully do it. And I've seen many, many cases that it happened. There was never a return. But do you hear about it? Is it on the market? Well, you know, the irony of it is there was a medical doctor who knew about it way, way back. His name was Dr. Mohs, M-O-H-S. He actually used it to kill the tumor, and then he did a surgical procedure where he sliced off sections of tissue under it to see that there was nothing left, and that was called Mohs surgery today, or it is called that today. Back then it was called Mohs chemosurgery because he actually killed the tumor with the salve. He put out a textbook on it. I have a copy of the textbook. You cannot go out and buy it today unless you could find one in some used store off in some obscure corner, but you can't go out and buy it. You never heard about it, and eventually he was forced to get rid of the salve that killed the cancer and just make use of his procedure of cutting tissue sections to see if all the tumor is gone. And it's just now called Mohs surgery. Back then it was called Mohs chemosurgery because he killed it with these herbs first. But those you're not going to hear about. And it just goes on and on. So this one company that was actually making the product, they weren't treating people, but they were making the product. It ended up that the owner of the company, before it was done, was arrested by the FDA, ended up going to prison, and I found out that not too long after he got out of prison, he died. Anyhow, that was his crime, producing a product that people could do themselves. Now, he sold it to anyone to use at home. And so he wasn't making wild claims about it or anything, but he did publish some testimonies from people who used it. And so what was his reward for doing all this? He was financially destroyed, and he went to prison, and I'm sure as a consequence of the stress and everything that went with it, it took his life, and he wasn't that old. So it just goes on and on. We see this thing happening over and over. There have been pioneers who came up, and we're going to cross over because we're going to run out of time as usual, and to the electronics. One of the doctors in this country who studied and received a MD degree from Heidelberg in Germany, but worked out of this country, he developed a method of diagnosis involving an electronic unit that he developed. And I don't have time to tell you how he finally got to that, but there was a series of things that led him to that. And he realized that every disease had actually a frequency that you could tell that the disease was there. And so it was both a diagnostic and a treatment type unit. And so he developed it, and all of a sudden it caught on. A lot of doctors were doing it. And guess what? He was smashed. But it did spread around the world before that happened. So there was a researcher in England by the name of George Delaware. This guy's name was Abrams, actually, Albert Abrams, the original founder of the concept. Okay, so it caught on around the world. And so this George Delaware brought in some scientists, and he was a scientist himself. And he proved to his own satisfaction and to these scientists that it worked. But guess what? They ended up taking him to court for fraud because they said it has to work. It couldn't work because there's no known scientific principle. Now, I know today that with quantum physics, there's a perfect explanation of how it worked, but at the time, quantum physics wasn't very well known. So anyhow, I went to court in England, and he brought in a group of scientists, reputable scientists, who had looked into it and it was proven to their satisfaction at work. They testified, and he was acquitted that he had proven that it was in fact valid. Well, now in England, see, there is a school that teaches this type of diagnosis and treatment, and there's practitioners in England that can do it. But in this country, you cannot do it, and if you do, you are subject to being raided by the FDA and having it confiscated and being put in prison for it. But yet, no drugs involved, work very well. So you're not going to hear about that one either. That one's been very well suppressed. In fact, it was out of his work. They said, we don't know of any scientific principle that could work, so therefore it has to be a fraud. And they came up with the term, it's just a black box. And so now when you hear that term, wow, that's one of those black boxes. It's supposed to do something, but it can't do anything. That's where that phrase came from, and it's a contemptible phrase, but it originated with Dr. Abrams' work. There was a researcher in France who came up with an electromagnetic machine, and that machine, he proved with research that it would actually activate the body's immune system against a tumor and get rid of it. I mean, he had ample evidence that that worked. But you know what? By the time it got down to the point that no one else, he had the rights to it, no one else could get it, no one else could make any big money off of it, and he wasn't even looking for money from it. He was a researcher. They ended up that they wrote all these articles. They publicized that he was a fraud, that the machine couldn't possibly work, and so forth, until it finally ended up that he became depressed and ended up dying, and they dismantled his machine and hid it away, and nobody has seen it since. So this is the type of thing that happens. There was someone down in South America, I found out, that did something similar. Same thing happened to them. As soon as it became evident that it could work, it was gone and he was gone. So this happens over and over and over. I'm just challenging you to go out and start looking. Christopher Bird, wrote about this particular guy in France. I don't know if you've heard of him. He wrote a book called The Secret Life of Plants and The Secrets of the Soil and The Secrets of the Great Pyramid. He and Peter Tompkins worked a lot together. I met him personally. As I say, a lot of these people we talk about, I have met. And no. Anyhow, he wrote a big article about the case in France and what happened, and he called it The Case of Antoine Prieur and His Therapeutic Machine, a Scandal in the Politics of Science. This guy was a really good researcher and in terms of research writing. And he went around the world and looked for things that people needed to know about, and he wrote about them. like the soil. How do you make good soil? He put out a book called The Secrets of the Soil, of all the methods that were used. But you will find that some of the methods that he uncovered have been suppressed also because, after all, it does not involve the use of pesticides and expensive chemical fertilizers, and yet you can grow good, healthy food, so we can't have that because, after all, the food processors and growers in the commercial interest make huge amounts of money with what they're doing, and so we can't come out with something simple that would affect their business. And I hope you are getting the message at this point that we're talking about business. The whole thing is business. Business, business, business. Money, money, money. Big money. We're not talking. You know, when people are sick, they're willing to pay big money if they have to get a cure. And they do. They chase doctors. I see people all the time that have chased name doctors all over the country that supposedly have some new medical breakthrough, but when it's all done, they walk away with their problem. And many of the regular medical establishment are good at appearing to know what they're doing and appearing to have something, but when you get the people who went there, it was something different than what they thought, and in the meantime, a fortune was spent, whether they personally paid it or the insurance companies had to pay it. Why are the insurance premiums so high? Because of this type of problem. Because we treat people over and over with substances that are not designed to cure anything. They're designed to make you feel better temporarily by shutting certain circuits down in your body, and therefore you think you're better, but the problem is still there, and then it goes deeper, then you come back with a more serious problem, which costs much more money to diagnose and to treat, but it still doesn't get well because now you come back later, the problem has gone deeper, more serious, and ultimately, of course, we see it gets down to this cancer thing, almost always, a severe cardiovascular problem or cancer, the two big killers, and then, of course, we will continue to treat you until you're dead. But does it help? Sometimes it delays things temporarily because it turns off things and you don't know anything is happening, because if you turn off the immune system, you don't have symptoms. Remember that the bulk of the symptoms that come from any problem in your body is your immune system somehow trying to deal with it. Now, there are some exceptions. If you take a blatant poison, a massive poison, like chemotherapy, it can totally knock out your immune system and poison you to death, which that's why they have to calculate how much to give you that won't quite kill you, but hopefully will kill the cancer. Unfortunately, it never kills every cancer cell. It is immunosuppressive in most cases, and so what happens? You end up dying ultimately of the complications of the cancer, because the cancer rarely ever kills anyone. It's the therapies and the complications that are the real culprit that ultimately take you out. So anyhow, I think we've given you enough, hopefully, to challenge you. And as I said, again, don't take my word. You go out and look for yourself. So we've ended another broadcast of MindYourHealthCast.com. I hope we've given you at least enough to stir you up, even if you think I'm totally stupid, crazy, don't know what I'm talking about. You prove it to me. You go out and find for yourself. Otherwise, we look forward to you at our next broadcast. Go to our website, MindYourHealthCast.com, see what's there. There's books on all the stuff we talk about. Go and read them. As I said, don't take my word. And go and research it for yourself. With the internet, there's no excuse for anybody to not be educated today in what's going on. And always remember, in the middle of every one of these searches you have, no matter what it's for, like I mentioned, pulsed electromagnetic therapy, you'll find a item pop up from Quackwatch saying, it's crazy, it can't work, it's totally fraudulent, there's no research to back it. And I still remember pulling up the one on pulsed electromagnetic therapy, and there was several hundred sites of universities, and even now a few devices that are on the market, actually allowed by the FDA, but for nothing serious, usually more minor things. But it's on the market, and here all this research is going on, but yet this man said there's no research, none whatsoever. And you'll see that in everything that pops up. If it pops up about the Cansema, or one of those black salves, as they call them, you'll see right away, no research. It absolutely is worthless. It's dangerous. Don't do it. And that's what you end up finding. So it's kind of interesting, and that's not bad with all this internet coverage and all the Quackwatch website from a person who has no visible means of income. And they've been sued and lost in court for their blatant misrepresentations, but they continue, so somebody's pumping money into it, and I'll just let you guess who it might be. At any rate, we look forward to seeing you on our next broadcast. Be healthy.